Hippocrates was one of the first to ever describe the distal radius and its associated injuries. Now, throughout the years, there have been numerous studies on the distal radius, but relatively few on distal radius variants among different countries. Good day, I'm Dr. Charles Reyes, and together with my advisor, Dr. John Hubert Pua, we present to you a cross-sectional study of the morphometry of the distal radius in the Filipino adult population. So distal radius fractures are actually the most common types of fractures seen by orthopedic surgeons. It accounts for roughly 18% of all fractures in adults. While women are more likely to have distal radius fractures than men, this injury seems to be more common in younger males and older women. In the Philippines, distal radius injuries are quite common. Local studies also show that the ratio of risk of having distal radius fractures is also similar to global statistics. So there is still a wide opportunity for local research on the distal radius. Aside from history and PE, the management of wrist injuries starts with an accurate assessment of standard radiographs of the wrist. So that the standard views include a proper or true posterior anterior projection and the lateral projection. So with a significant influence in the decision-making of managing these cases, the measurements of wrist radiographs is crucial in both the clinic and in research. With the acquisition of proper wrist x-rays, we are able to measure certain features of the distal radius. These represent the radiographic morphometry of the distal radius, which consists of 4 parameters. First is the radial inclination, which is seen on the PA view, showing the incline of the radial styloid in relation to the axis of the radius. Next, the Palmar tilt, which is seen on the lateral view. This is an angle measured between the line connecting the dorsal and the volar lips of the radius and the axis of the radius itself. The radial height, which is seen again on PA view, is the distance between the radial styloid level to the most distal surface of the ulnar head. Lastly, ulnar variance is also a measure of radial shortening. So this is the vertical distance between a line along the articulating surface of the distal radius to the distal ulna. In 2016, a distal radius cross-sectional study done in the US concluded that distal radius cortical perimeter was higher in Black Americans than Asians, while cortical thickness was greater in Black Americans compared to white Americans. So these results suggest that there is racial variance for these measurements that may also lead to a difference in the distal radius morphometry. So since then, there has been an emergence of different studies evaluating the morphometries of the distal radius in their respective countries. So this is the summary table of the data we gathered from parallel studies done in Asia. And this shows that there is still statistically significant differences in some of these radiographic parameters among the select countries. So the goal of this study was to determine the mean normal morphometry of the distal radius in the Filipino adult population. By determining the mean of the measurements, including their respective standard deviations of the normal radial tilt, radial inclination, ulnar variance, and palmar tilt of the distal radius of my sample population. My study population involved active patients at the Jose R. Reyes Memorial Medical Center emergency room, OPD, and our telemedicine consults with wrist complaints. So the selected participants compliant with the Amsterdam wrist rules were automatically part of the study population through convenient sampling. Their wrists were radiographed bilaterally. Using the official computer application of the Amsterdam wrist rules, I registered myself for the utilization of this tool to determine who among our wrist patients will benefit from an X-ray. So basically, I enlist them in the app registry and input the physical examination findings. So once done, the application will make a recommendation of whether to do an X-ray or not. So on this slide is a prospective cohort study that evaluated the validity of the Amsterdam wrist rules. So they concluded that this tool had a high sensitivity and high negative predictive value for fractures and dislocations involving the wrist. So thus, this was a good and objective decision-making probability model for my patient selection in this study. Inclusion criteria consisted of adult Filipinos aged 19 to 59 years old, so their radiographs should be of non-pathologic wrists. So this would mean no previous fracture, no dislocations, no osteopenia, nor osteoporosis. To standardize my data acquisition, the EBM UniWeb Viewer program was used at the JRRMMC Department of Radiology X-ray Reading Computer. So this was a single observer setup with only one computer used for all measurements. So for the results of this study, 56% of the participants were male, while 44% were female. 44% of the radiographs collected were of right distal radius, while 56% were left. And majority of the participants were from the 19 to 31 years old age group, with fewer participants from the 31 to 43 and 43 to 55 age groups. Results of this study show that the mean radial height for Filipino adults was 11.88 millimeters with a standard deviation of 2.10. Mean radial inclination at 24.35 degrees with standard deviation of 3.22. Mean ulnar variance was generally ulnar negative with a measurement differential of 1.57 millimeters. And lastly, the mean volar tilt, 13.23 degrees with standard deviation of 3.58. Using the determined standard deviation for each parameter, we can see that the ulnar variance was the only parameter with a wide range of results. So predominantly, my sample of participants showed ulnar negative and also ulnar neutral. Comparing the Filipino male versus the female participants, there is some difference in radial height, radial inclination, and ulnar variance. However, do take note that the comparison of these parameters have high p-values, which makes these differences statistically insignificant. Comparing the results of Filipino adults from the different Asian countries according to the other parallel cross-sectional studies, Malaysians had a larger value for their radial inclination, while Indians had a wider range of radial inclination angles. Volar tilt was also particularly smaller in Indians and Malaysians than Filipinos. But according to the data gathered amongst the sample population, the morphometric parameter values of the distal radius in Filipinos is very similar to the distal radius profile of the Indonesians. So the limitation of this study is the study design itself having a single center, single observer methodology. This study is also preliminary with limited time for data gathering due to the pandemic. So study population was relatively small, and convenient sampling was utilized for this study. Thus, there was low randomization. Further observational studies on the distal radius morphometry of the Filipino adults involving a larger number of participants or patients will ensure lower margins of error and increased homogeneity of the data. The results of this study may be used as a local reference data for normal anatomical measurements of the distal radius, especially for comparative analysis and outcome studies. Lastly, the data may finally introduce local measurements of the distal radius morphometry for further studies of the wrist or distal radius to be conducted in the Philippines. With that, here are my references, and thank you for listening.